talking about now are some of the data tools available for the CVEBs, and this is coming to us. Kathy is out at Purdue, and you see the information there, the MFRI, the Military Family Research Institute. And with that, I'll turn it over to you, Kathy.
Great, thanks so much. Thanks for giving me the opportunity to share one of our initiatives with you, and hope that it can help you in your work as you engage communities across the Northeast. So what I wanted to share with you today is our initiative, Measuring Communities, and how it can help the community veteran education or engagement boards. There's two institutes at Purdue who helped develop this, so the Military Family Research Institute, which I represent, and then our Purdue Center for Regional Development. And I'm not going to go over or in depth what each of us does, but we, MFRI does the military content, and then Purdue Center for Regional Development really works on the mapping technologies that are available on this site. So when you look at measuring communities and CVEBs in terms of how they can work together, we know that CVEBs, your focus is really identify goals at the local level and to prove these service deliveries for veterans and families and caregivers and survivors, everyone who's impacted by the military service. You also kind of work with people and places just in terms of getting communities, the folks within their communities, to kind of change their behaviors, their policies, their procedures, how they can work with veterans better, but also look at the places and how does that community as a place do a better job of supporting service members, veterans, their families. When I talk to organizations, you can have a veteran, two veterans with the same DD-214, same service record, same age, same branch of service, even the same deployments, but you put one in Boston and you put one in southern Mississippi, and their experiences within their community and the access to services and how they live their lives could be very much impacted simply by the places in which they actually live. So that's what Measuring Communities is actually trying to help with. So as you work in your community, sometimes it's really hard to, I'm trying to get the next slide here, to really know what to focus on. How do we know what we should be working on in the community? Lots of times we have very passionate people in our communities. They want to move forward in a particular direction, but there may be concern, is that really the direction that we need to go towards? So we know it's difficult to know what to focus on and to really understand the community characteristics that may shape or hinder and facilitate your efforts. So having data, having information can help with that. So we know service members and veterans and their families are really kind of embedded. We like to think that they're in a system. You can't provide a service strictly to a veteran or to a service member or to a family member without looking at the bigger picture, because veterans and their families touch all of these. They touch their communities. They touch their schools. Veterans with young children are in the public schools and the high schools. They may be going to college. We know they're in the healthcare system, whether it's the VA or private, and at mental health as well. So we look at these service members and veterans and their families kind of embedded in touching all of these systems. So CVEB members, we know you want to connect with other community stakeholders who are interested in serving veterans and their families. A lot of what you do is collaboration and kind of help others work to improve the outcomes in terms of where they live and they work and they raise their families. And you need tools to do that. How do you learn about the landscape? How do you look at this evolving needs of veterans and their families? What they needed 6 years ago just in terms of employment may not necessarily be what the picture is today. They may need help with some other things. So Measuring Communities is one of the tools that we want to offer you to help in your work with the CVEBs across the country. So Measuring Communities, kind of what is it? So it's a tool to really kind of look at this military and veteran relevant information in geographic areas that you choose. We do have information every community in the country. So learning about the military and the veteran characteristics and demographics. You also can look how communities are changing. We have historical data on here, so you can look for trends. What is the employment rate in communities? How has that changed? What is the makeup of the veteran population in different communities, and how has that changed over time? Are there communities that have all of a sudden a surge in female veterans coming back into that community? You can also learn how communities compare to one another. So if you've got CVEBs that are kind of close, or that you're looking at a CVEB that may serve multiple counties, how do those counties compare with one another? And map your status and your progress. What are you working on? How can you help, quote, move the needle for veterans, the service members, and the families within that community? So the tool is actually divided into domains, and a lot of this is based on community mobilization efforts across the country. Community Blueprint is one of them that we modeled this after. So we have 10 domains, and there's data in all of the domains, and these are really efforts or domains where your efforts can be focusing on. So for example, behavioral health here, a lot of focus is on mental health. How can we make sure that there's sufficient capacity within our communities for mental health, employment, financial, housing, demographics. So these are areas where you might have focus. So within the domains, we have indicators, and so there's several indicators or statistics that are readily available for you. They come from multiple government agencies, so whether it's Department of Labor, the Census Bureau, the VA. We also have state data available, and it does include the most recent data that's currently available. So, for example, when we use the Census Bureau and the American Community Survey, they have published data through 2016, so as soon as they publish the 2017 data, we update that on the site. So most of our indicators are updated on a yearly basis. Right now we are literally days away from the new VA data coming out in terms of the GDX, and any indicator that uses that information will be updated probably within a few weeks. So indicators are added regularly. We just added insurance coverage by county in terms of who has Medicaid, Medicare, who uses TRICARE, who uses VA services within the community. And they deal with both veteran and general community characteristics, and we feel this is important because just to have a number for the veteran population, if we don't look at it in context, we may not know or understand how the veterans are doing as compared to their civilian counterparts. So for example, poverty rate is one of those, or median income. Employment is another one. If you say young veterans may have an unemployment rate in this particular community at 10%, that's very concerning. It should be better than that. And yes, that's true. But if you compare that to the civilian population of the same age and their unemployment rate is, like, for example, 20%, you know then that the veterans in that community are doing much better than their civilian counterparts. So we're really trying to make this in context to help you understand where the veterans are and how they're doing, as opposed to just a raw number. So on the tool, what can you do? You can look up and download data for geographic areas of your choosing, including ones that you make up. So if you have a catchment area of multiple counties, you can download that data. You can download it for the entire state if that's what you choose to do. You can make custom maps, tables, graphs. We do have ready-made state and county snapshots. So if you're going to community members and they may have no idea about the veteran makeup or the military makeup within their community, this is a great place to start. Using the data, you can actually create simple indices to identify areas of concern or strength. You can kind of, determine what indicators you're interested in and give each criteria or indicator score based on a certain point or certain level. For example, median income, if you want to see where veterans are doing better as compared to their civilian counterparts, you can download both median income for veterans, median income for civilians, and if it's higher, that's great. They get a 1 because maybe it's a strength, or if it's lower, they get a 1 because you want to look for areas that are of concern. You also can combine the Measuring Communities data with your own community data to create something specific that you may want to use. And I have an example here. So one of our users is a veteran service officer here in Indiana, and you can see he has used Tableau to kind of do a pictorial, this infographic, because he was really trying to advocate for additional resources for their community in terms of more hours for the veteran service officer. And you can see by the yellow arrows This is the information that he took from measuring communities and added it with the data that he had within his office. So really kind of using both his information and measuring communities to advocate for additional resources. So this is just one example of how you can use that kind of information. So with the information, how does it apply? What can you do with it? So a lot of the users of measuring communities look to identify gaps in support that are really actionable at the state and local level. So measuring communities is not a resource locator. You're not going to be able to find where is the nearest food bank and things like that, although we do have some service locations on there. But you can look at gaps in support. Where do we find these kind of holes of service? You can use these gaps to kind of build and adjust services so you can meet the needs of your customers. You can use the data to kind of, how is our area doing compared to the state average or the national average? Where do we fall? And that may also help kind of guide you in terms of, this is an issue. Maybe the state's doing well, but in our area we're not doing as well. So maybe that's something we can focus on. I talked very briefly about using the civilian data to compare how their veterans are doing compared to their civilian counterparts. And this is an important one, because if we want to make sure that we're working to make veterans' lives better, if there's an area where they're not doing as well as their civilian counterparts, that may be an area that helps us focus our efforts. And you can drill down further to get more detailed picture of any particular domain indicators, such as veteran demographics, era of service, age, gender, all of those different kinds of things to help better understand the veteran population where you are. So on this page, you can see the URL at the top, and we do have an organizational ID for you, and it's right here, NAMYBA 17. This is your access code when you log in, and so this actually gives you access to the entire site. So as you're working with your community mobilization groups or your CVEBs, go ahead and use this code. There is a 90-day cookie, but you can use this code to log in. When you enter, you actually can get data 3 different ways. So you can enter by the domains, which are here on the top, and you can see those. We have the state and county snapshot here at the bottom, and then we have a master map. My suggestion to you is to kind of either explore by topic first and get familiar with all of the tools there before you go to the master map. But the state and county snapshot is actually one of those places where you can go right away, have 3 clicks, and you can get some data. So you just click the button, decide if you want a state or county snapshot, and it provides you a standardized look, pulling either state level data or county level data. And if you have multiple counties, it'll look very similar, but this one happens to be Franklin County, Vermont. But it's the information from the site, pulls it, and you can print this, you can PDF. It takes 3 clicks, and you can generate this standardized report. You can also download data, and so here's just one example that maybe someone's looking at the disabled veteran population in their county versus some other counties. So I picked a few counties here, and I kind of have a step-by-step kind of thing, and actually I'll share these slides with Tony so he can then distribute them. But we'll look at medical, select the percent disabled, and so we can find here are the number of veterans in each of these counties that are 0 to 20, 30 to 40, 50 to 60, 70 to 90, or 100% disabled. And when there's no data, that means that there are no estimated veterans with that service disability. And then after you make your own table, you may want to combine data with others, such as veteran populations, so you can actually create specialized databases that are tailored to what's important to you. And then when you have that information, you can actually then create your own visual. So I took those 3. I have these 4 counties in Illinois, and you can see then the percentage. So what county seems to have a higher percentage of veterans in any particular disability category. So we can see here in Wayne County, we've got quite a high percentage of the 70 to 90%. But then too, here we have where we don't have any veterans of that particular disability rating. So you can see here the red areas might be areas of concern, and here with the green area, this might be not something that we need to be concerned about at this time. There could be some other things that we need to be looking at. So here's just an example of pulling the data from the site and using it to kind of create customized things to what you need, what individual counties and CVEBs might be looking at. We also have an online report that we actually just published on May 14th, and you can download the report. And basically what it does, it gives you this kind of this national look at the state of military and veteran families across the country. It's our first report. It's kind of our benchmark report, but it has a section for each of the domains that's on the report, along with some visuals, and then information just in terms of kind of a call to action. How can you or your community help with this particular thing? So we also have an enhanced report which provides additional data, and so as folks who already have an ID, you have access to that enhanced report. So I know I only had about 20 minutes, and this is just very, very brief, but I would like to open it up to questions if anyone has questions for me.
Okay, Kathy, we do have a question from here in Manhattan. So, what?
Hi, Kathy. I'm Trey Austin.
Hi.
How you doing?
Fine.
I just want to let you know that was extremely informative, and very useful presentation, and so I thank you very much for that. Just one quick question, and I may have missed it, but what resources do you use to gather all of these information across the United States to put it all into one, little easy access website for us to retrieve it from?
Sure. We have over 30 different data sources that we use. So depending upon the indicator, and right now we have over 50 indicators. So depending upon what indicator that is, it has a different data source. So we have publicly available governmental data. So we have the Census Bureau, American Community Survey, we have the VA. Those, if anyone is used to working with that information, you can go get it, download it yourself. You don't have to go to this site. We kind of pull it all together. Other things like state tax benefits, we actually go to the individual state website and take a look at that. There's TRICARE information, so we go to the TRICARE websites. Some information is not necessarily publicly available. We use our data partners, such as the Blue Star Families Report, that looks at their level of satisfaction with access to certain types of services. So that's kind of another source that we use. We also get the service member data from DMDC, or now OPA, and that's actually sponsored through the National Guard Bureau. They help us get that data, and that's not publicly available, but we have it on our site. So in a roundabout way, we have 30 different sources of data. Every time a new data source is published or they update it, we then update the information. And there is a place on the site where you can actually find out what, for each indicator, what data source we use and what are the dates of the data. Some things are updated every year. Some things may not necessarily be. For example, veteran households with children, the VA put that out in 2015. I'm not sure how often they're going to update that. We'll definitely look for it, but it may not be updated for 2 to 5 years. So hopefully that answers your question.
Oh, it did, and thank you very much. That was I found it very interesting. Thank you.
Anyone else in the room here? I don't see anyone else in the chat room. We did have a question from Herndon, but that question got answered in the course of answering your question, Trey, so we're good. All right, anyone else? Excellent work. Okay. Kathy, thanks so much. This again.
Okay, we have Donald Carter has raised a hand. I got that flashing on my screen. So.
Awesome. Okay, Donald, go ahead. Ask your question. Make sure you unmute. Okay, I am not hearing the question. I don't know if you're unmuted, but if you want to type it in the chat box, I'll ask it for you.
While we're waiting for him, I have a quick question.
Okay.
Hi, Kathy. It's
Hi.
Mary Carstensen here.
Hi, Mary.
I think, could you address a little bit of, with the CVEBs about how often they might want to look at this data? I mean, you really kind of touched on it a little bit about the frequency of the updating of the data. But I think when we're talking about asset assessments, gap analysis, maybe could you address that, how you envision they're using, or how often they would go back to the site?
So I think it's probably a two-prong approach. So first of all, going to the site and seeing what's on there, and then taking a look at and really kind of creating this picture of the landscape. So you may want to go into each of the domains and say, okay, how is our community doing, or what's happening within our community? And then as they strategically plan, think about, okay, so what data do we really want to know? What information can we then have impact on? Then, once you kind of figure out what this lay of the landscape is, the fact that we update the data every year, but we do it on a rolling basis, once plans are put in place and actions being taken, then going back every 6 months and saying, okay, where are we? Where is the community? Because, like, for example, the VA data comes out in summer, the Census Bureau comes out in December, and so you kind of have this half-year kind of look where new data, big data kind of comes out. So I think once plans are in place, then looking at it every 6 months just to say, okay, so where are we? Where's our community? And know that a lot of this, is estimates, and as best as we can, there's a lot of margin of error within some of the data sources, and we understand that, but it's the best that we have. So I think probably, once you use it to kind of determine what the course of action is going to be for the group, then going back about every 6 months and kind of taking a litmus test and seeing, okay, where are we right now? Have we gone up? Have we gone down? That kind of thing. Have we stayed even? Is the, civilian sector getting worse and our veterans are staying strong? Those kinds of things. So that's kind of what I would suggest.
Yeah, very good. Thanks. Appreciate that insight.
Okay, I'm sorry, go ahead, Kathy.
Well, and communities can go back. So a lot of organizations and communities also use this for grant writing. So even if they have strategic plans in place, if a grant opportunity comes along, this is information that's at your fingertips in terms of being able to prepare, grant information. So even if you took a look at it 6 months ago to do your strategic plan, if a new philanthropic partner comes across and, wants to, help fund something, CVEBs can go back to this and say, okay, can we apply for this grant, and here's the data at our fingertips to help with that grant application.
Yeah, really good idea. Good point.
Hi, Kathy. This is Elon Wiley, Massachusetts.
Hello.
Hi. Thanks for your presentation. I like what you talked about, the different places that you're getting your data sources from, because I was involved in receiving some information from the RAND study. And we were led to believe, and we had some consensus among some of the providers within our state of where certain gaps in services were in our state. And then as a result of the survey, we found that maybe those gaps were not necessarily there. It more or less had to do with, we knew where the population of the service members or the veterans were, but they were not necessarily taking advantage of the resources available to them, or maybe they just didn't even know that they were there. And can you just expand a little bit on what your research has found with that?
I think you bring up a good point in terms of, how do you identify a true gap, and that really helps, with people on the ground such as yourself, because you got a pulse of the community, and so I think it's really good to say, okay, so what is the research telling us, and okay, so we have gaps here and we have gaps here, and this is what the research is telling us, but then using the information within the site to really kind of dig deeper, because very exactly what you said, is it because there's a true lack of service, or is it a lack of knowledge about the services that are there? Now, again, measuring communities is not a resource locator, but it can look at, okay, so where's pockets of this and where's pockets of that? And so your knowledge and using your information that you have, your data combined with measuring communities, you can really drill down and say, is that truly a gap in need, or is it a gap in knowledge? And so using kind of both, research, measuring communities data, and then data that you have about, what's going on the ground can probably give you just a really strong picture about where you need to focus.
Thank you very much for giving us that ID so we can go in and use this tool. That's a big help.
Yes.
Okay, anyone else? I know someone had raised a hand to ask a question, but we couldn't hear, and I don't see it in the chat box. So any other questions before we move on? Okay, nothing heard. We will have another chance to ask questions here shortly, so we're going to move on. Kathy, thanks again very much. That was a very